You do immune boosting IV therapy, and I actually have done that myself. I, along with a lot of my family members, suffer from needing to boost our immune system from time to time, and I was able to reverse an autoimmune disorder, and I have a lot of families with autoimmune. Sometimes when I get the flu or get a cold, I just have a hard time getting to the other side of it. So I've used immune boosting therapy. But from a medical perspective, can you talk about that and why, besides my own personal experience, why that is helpful for patients?
Sure. So we know that there are a number of ingredients. So one thing with Invita is we custom blend our bags. So a lot of, the IV places are kind of popping up all over the place. But a lot of those places will it's kind of a one size fits all. You'll order something from a compounding pharmacy and it will just be, this plethora of vitamins and it gets squirted into a bag and that's it. So we do try to customize those for patients. But one thing that we know is that there are certain ingredients that go into both preventing illness, in way of it ever occurring, as well as shortening the duration of that illness. So those are things like vitamin C, magnesium, some of the B complex vitamins, zinc, things like that. So we have immunity bags that we recommend for individuals who are both fighting an illness currently or maybe getting ready to travel or something where they may have a little bit of a higher incidence of being exposed to someone who is not as healthy as what we would like to be.
And tell the general public why IV versus just taking the vitamin C supplement.
I don't ever tell anyone not to take their vitamins. I think that just overall wellness absolutely makes someone feel better. But the truth is the bioavailability of most of the commercially available vitamins is between like 7 and 17%, meaning if you take in 5,000 milligrams of vitamin C, you're probably only getting about 200, maybe 400 milligrams of that vitamin C. There's a number of vitamins that are available as an intramuscular injection, but vitamin C in particular, if you take that intravenously, then the bioavailability there is anywhere from 97 to 100%. So you're actually taking it and absorbing before it's processed through the liver. A lot of those types of vitamins and nutrients and minerals that we know fight infection, but you're able just to absorb a lot more of them more readily.
NAD therapy.
Yes.
Primarily at the beginning, as my understanding, it was used for substance abuse to get people over that hurdle. Mm-hmm. But it's now being used for kind of anti-aging, regenerative medicine, and to perk up your mood.
It's the fountain of youth drug. So back in the 70s, they started using it for alcohol addiction, for both opiate and benzo addiction, as well as to help patients that had been on a number of mood stabilizers to just try to kind of detoxify the system, and as well as support some of that cellular regeneration that comes with a lot of the stresses and things like that come with those disease processes. It really, since functional medicine has really taken a little bit more of a forefront in more of a preventative, holistic approach versus just, oh, you have this symptom, let's throw a medication at it. And just to be totally clear, I am not anti-Western medicine whatsoever. Obviously,
sure. I'm not either.
Obviously, I practice anesthesia, so we don't have like a poison dart frog or anything in the operating room that we're using. But I do agree and believe that if the body's in alignment, if you have enough vitamin D and enough vitamin B12 and things like that, it just makes sense that you're just going to feel better overall. So since that philosophy and patients really wanting to have a little bit more control over their health, gut health, things like that have came to the forefront, then this has really came back to the forefront and is being investigated for a lot more of the diseases, as well as just overall kind of daily activities that it can help with. So NAD, which stands for nicotinamide adenine dinucleotide, is basically it's a coenzyme. So it's present in every single cell, and it deals primarily with the mitochondria and energy regeneration and things like that. So, and not to get too technical, but because of its mechanism of action, it can be used in things anywhere from substance abuse, all the way to athletic recovery, collagen regeneration, to cellular detoxification, to a lot of the neuromuscular and neurodegenerative things like Alzheimer's and Parkinson's, mental clarity, depression, anxiety. There's just, I mean, the list is endless on what it can help.
For the average person that doesn't currently have an ailment, what have you seen when they do NAD therapy?
Just overall a feeling of wellness. So even if you're not clinically diagnosed with anxiety or depression, we all have those days. And the truth is, those kind of, whenever you are in an anxious state, then that's going to raise your cortisol levels, which is going to, has a whole host of things that it does as well. So this basically is going to go in and it kind of just cleans up everything. So in way of metabolism, it's going to help speed up metabolism. Weight loss is always something that, I haven't met many people who are like, no, I'm not interested in shedding a few pounds, As we get older, everything just slows down. So, and the truth is, NAD is something that has always been present in our body, but as we age, those levels decrease. So what they have found is that by increasing those levels at a cellular level, that you can actually slow down the aging process, if you will. Athletes use it after heavy workouts and marathons and things like that. And it's, even to the point of it being banned in some sports as a performance enhancement. But for the folks that aren't suffering from chronic diseases, then they generally will report things like increased metabolism, increased mood, sleeping better, increased mental clarity, less fogginess, more energy, better hair and nail and skin, growth and regrowth, just overall making you feel better. So what we've seen in way of some of the neurodegenerative things are just improvements in clarity, improvements in that mental fog. And then, unfortunately, with a lot of those disease processes we see Parkinson's depression. There's actually just a diagnosis code for Parkinson's depression. So it can definitely be a mood stabilizing, mood uplifting kind of thing for those patients as well.